10 cancer symptoms most people ignore. 10 cancer symptoms most people ignore. Hello friend, today we will talk about the 10 cancer symptoms most people ignore. Before you discount that persistent cough as just another part of flu season, you might want to ask your doctor to give it a second glance. According to a new study by Cancer Research UK, more than half of adults have experienced alarm bells that could mean cancer, yet just 2% of them believed cancer could be a possible cause. Researchers sent questionnaires to nearly 5,000 UK residents registered with general practitioners, in other words, men and women who haven't visited a primary care doctor. Just shy of 1,800 people completed the questionnaire, and 5 were eliminated because they indicated they'd already been diagnosed with cancer. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like and share the video. Please leave the comment below. Ten cancer symptoms most people ignore. Here is the list of 10 cancer symptoms most people ignore, which we discussed one by one. Persistent cough or hoarseness. Persistent change in bowel habits. Persistent change in bladder habits. Persistent unexplained pain. Change in the appearance of a mole. A sore that does not heal. Unexpected bleeding. Unexplained weight loss. An unexplained lump. Persistent difficulty swallowing. Symptom number 1. Persistent cough or hoarseness. Persistent cough or hoarseness. While a cough here and there is nothing to worry about, a consistent cacophony or a cough accompanied by blood is definitely cause for concern. Most coughs are not cancer, says Therese Bartholomew Bevers, MD, Professor of Clinical Cancer Prevention and the Medical Director of the Cancer Prevention Center at the MD Anderson Cancer Center. But certainly a persistent cough needs to be evaluated to see if it could be lung cancer. Your physician should recommend a chest X-ray or CT scan to rule out cancer as a possibility. Symptom number 2. Persistent change in bowel habits. Persistent change in bowel habits. When your bowel movements aren't as easy as they once were, or your stool appears larger than normal or somewhat deformed, this could be a sign of colon cancer, says Bartholomew Bevers. It could be a sign that there's a mass impeding the transit of the stool from the bowel, she says. This is a symptom where one should go to the doctor and schedule a colonoscopy to see if there indeed is a mass. Symptom number 3. Persistent change in bladder habits. Persistent change in bladder habits. If there's blood in the urine, that could be indicative of bladder or kidney cancer, but more commonly this is a sign of a urinary tract infection, says Bartholomew Bevers. Check for an infection first, then pursue other treatment options. Symptom number 4. Persistent unexplained pain. Persistent unexplained pain. Most pain is not a sign of cancer, but the persistent pain must be checked out, says Bartholomew Bevers. If you have persistent headaches, for example, you likely don't have brain cancer, but it is still something that must be looked into. Persistent pain in the chest could be a sign of lung cancer. And the pain in your abdomen could be ovarian cancer. Symptom number 5. Change in the appearance of a mole. Change in the appearance of a mole. While not all moles are indicative of melanoma, spotting a new mark or one that has changed is something you should bring up with a dermatologist who can screen for skin cancer, says Bartholomew Bevers. Symptom number 6. A sore that does not heal. A sore that does not heal. If you have a sore that's hanging on past the 3-week mark, you should bring it up with your doctor. We would have expected our body to have healed itself by now, says Bartholomew Bevers, and you should absolutely get that checked out. That kind of sore could be a sign of carcinoma. Symptom number 7. Unexpected bleeding. Unexpected bleeding. Vaginal bleeding, outside of your normal cycle, could be an early sign of cervical cancer, while bleeding from the rectum could indicate colon cancer, says Bartholomew Bevers. Symptom number 8. Unexplained weight loss. Unexplained weight loss. As adults, we try very hard to lose weight, says Bartholomew Bevers. But if weight is falling off of you without any effort on your part, that is a big concern and can be indicative of a serious medical problem. One of those problems, she says, could be malignancy or a tumor. Symptom number 9. An unexplained lump. An unexplained lump. Anytime you have a lump that is new or a lump that is changing, that is something you should absolutely have looked at by your doctor, says Bartholomew Bevers. While it could be a benign cyst, and likely is, it could also be cancer that is in the subterranean tissue. A lump in the breast, of course, is a very common symptom of breast cancer. See your physician to get more information. Symptom number 10. Persistent difficulty swallowing. Persistent difficulty swallowing. 2 cancers may be behind this symptom, including neck and esophageal cancer. People who see these symptoms will often start to modify their diets, eating softer foods without thinking there could be a more serious issue. The bottom line, says Whitaker, is that if people are experiencing any persistent symptoms, they should go to their doctor for advice. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like and share the video. Please leave the comment below.